honored to be on with you all, as well as
Sure.
Dr. Kaplan. He's this I've had other opportunities to either speak with him or sit on panels with him, and he is a wealth of knowledge and energy. It's
Yes.
fantastic.
Yes. As are you. We're so excited to hear from you today.
Oh, thank you.
We pass controls over to you, so you should be able to run through the slides, but we'll let you take it over from here.
Sounds good. I will do that. Let me make sure I'm sharing the right screen. Okay. All right. Sorry. Just okay. You're able to see my screen, is that correct? Yeah. Cool.
Yes.
Okay. Awesome. 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 All right. So, my name is Andrea Daniels. I am a pharmacist as well as the VP of Clinical Services for Strive Pharmacy. I heard some talk about pharmacies in the last lecture, and Strive Pharmacy is a 503A pharmacy, just as Dr. Kaplan was talking about different types of pharmacies. So, we are a patient-specific prescription pharmacy where prescriptions will come to us. We're able to fulfill them and send them out to your patients. So we're thrilled to be here today to help host this MedBio lecture and whatnot. So I'll dive in. We were asked to kind of talk about things other than just weight loss, and one of my biggest passions is skincare as well. And obviously, we'll dive into it further. But as patients start to lose weight, and gain confidence in who they are and how they look. Oftentimes they will come to you for help with their skin or their hair and whatnot. So this is a really great opportunity for you as a provider to increase your revenue and also increase your patient's confidence. So. As a disclaimer, this presentation is for educational and informational purposes only. It's not intended as medical advice to diagnose or treat. These statements have not been evaluated by the U.S. Food and Drug Administration. Compounded medications are prepared for individual patient needs based on a valid prescription from a licensed healthcare provider. Strive's compounded medications and supplements are not reviewed or approved by the FDA to diagnose, treat, cure, or prevent any disease. The information shared is based on current literature and clinical experience. Individual patient care should always be guided by a qualified healthcare professional, such as yourself. While clinical data exists for FDA-approved commercial products, compounded products are not FDA approved and have not been studied for safety or efficacy. Potential benefits apply to the specific ingredient and may not necessarily apply to a combination. And last but not least, any experiences or outcomes mentioned do not indicate or guarantee similar outcomes for all patients. Individual experiences and outcomes may vary. Whew, that was a mouthful. Thank you so much to Strive's compliance team. Okay, agenda for today. We'll talk a little bit about the weight management journey, talk about skin changes and some clinical context behind that, procedure support and recovery, topical pharmacology, topical product toolkit, and then potential membership and revenue strategies. Now, when we talk about Strive Pharmacy, I gave you a slight introduction earlier, but Strive Pharmacy really focuses on the personal side of medicine. We like to look at your patient as a whole and see that what we are doing, how we are treating our patients together in combination with you is more than medicine, and that the human element drives everything we do. So that's kind of Strive Pharmacy's thoughts on medicine and how we our views on how we like to treat our patients. But when it comes to skincare, there was a group of about four of us that really have a huge passion for skincare and whatnot. And we came up with a number of different products that are fantastic for your patients. So when it says Strive is made by people for people, that includes myself, Christina, Hope, and Sarah. We kind of were the driving force behind some of our dermatology products. And our goal really is to support vitality in skincare. So that's healthy and well-nourished skin, radiant, glowing skin, firm and resilient skin, well hydrated, even toned, and even textured. So that's really the ultimate goal when we're looking at different skincare products. And then, of course, formulated for every moment in time and every era of skin. your patients are every age. You'll have younger patients up to older patients. So it was really important for us when we were curating this line and some of these products that we were able to focus on every patient in every stage of their life with a number of different disease states in mind. So I love this quote. Beauty is about refining what makes you uniquely you. Let yourself shine through. And what you're doing for your patients is allowing them to shine through and really be the absolute best version of who they can be. So, I thank you for being here today to learn this, but for also having your patient, forefront of your mind, continuing your education, continuing to learn different opportunities that your patients will have. So first, we'll dive into the weight management patient journey. So this is the journey of your patients who are experiencing your medical supervised weight management. For many, this journey isn't just about shedding pounds. It's a holistic transformation. So as our patients embark on the GLP journey with your guidance, again, information on diet, helping them obtain an exercise program, they'll begin to notice significant physical changes. And these newfound body awareness can lead to an increased interest in aesthetics as they seek to enhance their appearance further. So this inflection point is going to present a unique opportunity. It's the perfect time to introduce health or skin health services and compounded topical regimens. So by integrating aesthetic services, we can support our patients embracing their new selves fully. And by understanding and tapping into this journey, we can make a meaningful impact on our patients' lives, helping them to feel confident and vibrant in their own skin. Next, we'll talk about the psychology of self-perception after weight loss. So as we look at this, we uncover a fascinating aspect of the weight management journey. One of the key points is that the body image often lacks behind physical changes. So this means that even after a patient has maybe achieved their weight loss goals through medication, through those diets that you've helped provide, and through an exercise program, their psychological self-image might take a little bit of time to catch up. So this transition period is crucial as it often leads to increased interest in personal appearance and aesthetics. So, as patients come to term with their new physical reality, many report a boost in self-confidence. And this has been a beautiful thing I've seen over these last few years as we've been a part of this weight loss journey with patients is, all of a sudden you kind of see a change in their own confidence. You see a change in how they hold themselves. You may see a change in even, their language and how they speak of themselves and even, speak to people. So this is a fantastic area where you can step in and help to just continue that process for them. And one of the ways to do that is through aesthetics. So it's important to acknowledge that as these aesthetics concerns arise, patients are going to notice some skin laxity, some other issues, and this is where you play a vital role. So by guiding patients through this transition, you can help navigate those changes and even enhance their own self-perception. So lastly, let's look at some of the statistics. So, a significant portion of weight loss patients, specifically those who have lost more than 10% of their body weight, will show a heightened interest in aesthetic surfaces. Interestingly enough, 63% of those seeking facial aesthetic products or procedures were not previously engaged in any medical services, aesthetic services prior to, and 32 had never even considered it before. So that's a huge percentage of patients who have never even considered, utilizing medical grade skincare, had never considered utilizing different aesthetic procedures that you now can maintain as patients, even for an extended period of time, maybe even once they reach those weight loss goals. So, as we move on to the next topic, we'll explore the specific skin changes that may accompany significant weight loss and clinical insights that can guide the aesthetic interventions. So, what do these patients see? So, skin changes following significant weight loss. In this slide, we'll look into specific skin changes that can accompany that weight loss. which can be transformative. But yes, this could be a challenging period for patients. So firstly, let's discuss skin laxity. So with rapid weight gain or with continued weight, the skin will stretch and dermal collagen and elastin stretches, leading to notable, and then once weight is lost, there's obviously noticeable looseness, particularly around the abdomen, the arms, the thighs, the face, once that weight is lost. So this can be a concern for a lot of patients, and as they adjust to their new body. Now, Dr. Kaplan is going to be much, much more well versed in the different procedures that can be utilized to help patients through these concerns and whatnot. But I will hit on some of them. I just know that he is definitely a much more of an expert when it comes to skin surgeries, body surgeries, and whatnot that go along with it. So we'll just hit on them slightly. Next, we talk about hyperpigmentation. So, with weight loss, there are hormonal changes. And during that, there can be an increase in melanocyte activity. This can cause pigmentation changes. So it's important for us to be vigilant about these shifts and address them proactively. So, once the patient starts noticing those changes, maybe in their skin tone, the skin color, to be proactive about it as opposed to allowing it to get worse and worse over time. Collagen degradation. So this is big. There's a lot of reasons why collagen decreases over time, but with this extended caloric restriction, it can impact collagen synthesis as well. So this will result in texture irregularities, fine lines, and when this is coupled with barrier compromise due to changes in sebum and water loss, it can lead to excess dryness or sensitivity. Lastly, let's not forget vascular changes. So this happens so there'll be dermal thinning. There can also be, patients may also notice that some of the vasculature, the blood vessels are near the skin surface, so there's some redness and whatnot, resulting in just an overall uneven skin tone. So these changes are critical for providers to understand when guiding patients through their weight loss journey. And it allows us to tailor some of our aesthetic services to meet their ever-evolving needs. Now, we'll dive into a few of the options that can be utilized in your offices and whatnot to help with some of these conditions. I know not everybody has an aesthetics office, not everybody is even interested in it, but these are just some different options that can really help patients with some of those concerns we just spoke of. Again, I preface this that I'm not the expert in this. That's really more of Dr. Kaplan's field as well. But just know there's a number of different options that your patients can utilize to help with skin tightening, to help with skin resurfacing, injectable aesthetics that can help kind of build some of the fat that has gone down. It can kind of build up those areas again, decreasing that concave look that some patients will explain that they have after weight loss. And then body contouring support as well. So, how can Strive help you through this process? First, let's talk about some topical anesthetics. So, with a lot of these treatments, topical anesthetics are utilized to help with patient comfort. And we customize or we compound a number of customized topical anesthetics just for that. So, within these formulations, you'll often hear of BLT creams. When I started in compounding pharmacy, I had no idea what that meant. Somebody called in a BLT cream, and I was like, okay. So had to reach out to my counterparts. I'm like, what is BLT? Bacon, lettuce, tomato. What are we talking about? Benzocaine, lidocaine, and tetracaine. So most commonly, those three are combined. Benzocaine acts as an ester anesthetic. This is going to be the one that has the most rapid onset. So this API, active pharmaceutical ingredient, is going to have the most rapid onset, and it has a duration of effect of about 15 to 30 minutes. So this particular API is great for providing quick surface anesthesia and is commonly used in BLT formulations, as I was stating, at a percentage around 20%. Lidocaine is going to be our next product. That's an amide anesthetic. Its onset is about 3 to 5 minutes. Its duration is a little bit longer. So this is going to be, its effectiveness is enhanced when it's used with penetration enhancers, which I will speak about in just a moment. And this is going to allow for deeper penetration. So this is going to get a little bit deeper into the skin. And with lidocaine, we often see it at a percentage of about 10 to 23%. Next is going to be tetracaine, another ester anesthetic. And this is the longest acting product within the BLT cream. So it goes to work within about 5 to 10 minutes and can last about 45 to 90 minutes. It's going to be better, more effective for deeper tissue. So those procedures that may have deeper tissue penetration or whatnot, this is going to be a great option to have on board. Lastly, we talk about phenylephrine, and this is quite an interesting addition to these products. Phenylephrine will go to work within 3 to 5 minutes, and it acts as a vasoconstrictor. So what it's going to do is help prevent systemic absorption of the benzocaine, lidocaine, tetracaine, help to keep those active ingredients kind of centralized exactly where you want them. And it can actually help to reduce site bleeding as well. So if procedures are being done, it can help reduce the bleeding. All right, so next we'll jump into some commonly prescribed products. Now, something to note, and you'll see there at the bottom, is that there's a suggestion to keep the percentage, so the full percentage of the total API, again, that stands for active pharmaceutical ingredient, at or below 34%. Now, what they've found over time, we've been doing this for a while. What we found is that once the product is over 34%, oftentimes it'll break apart. So the different active ingredients will fall out of solution basically. And they can be mixed again, but it's just not as pharmaceutically elegant once you get over that 34% and those products break out. So that's something to keep in mind if you order some of these products and a pharmacist calls you to say, it'd be best if we kept it closer to this 34%. Just know that that's the reasoning behind it, is that the products can break out of their solution, and which is not ideal, obviously. So our most commonly prescribed compounds are going to be the benzocaine, lidocaine, tetracaine. That's at the 26.4%. Benzocaine, lidocaine, phenylephrine, tetracaine, which is done at 26, tiny bit of that phenylephrine, and then that 4% tetracaine, and then lidocaine, tetracaine as well. So lidocaine at a higher strength with that tetracaine. So that, again, that is going to be your product that is likely going to be used for those more severe procedures that you might be doing. Now, something that's interesting is also the bases that we place them in. So the base is going to be the cream or the ointment that it's placed in. So you'll see options for a plasticized ointment. So this is just a standard petrolatum base. This is great for surface to superficial. There's also lipoderm anhydrous, which is more of a cream or a gel. This is one that's going to get deeper into the skin and is going to be great for get into the dermis or the subcutaneous tissues. So for a little bit of those deeper procedures. And then there's also a permeation enhancer that can be added, and that is called Permeate. So it will actually help the product to permeate deeper into the skin tissues. So that's for more of your superficial or your mid-dermis range procedures. Now, post-treatment recovery, this is another area where Strive really can help your patients with recovery and whatnot. So we compound a comprehensive portfolio of topical actives that contain ingredients with established clinical use to support various phases of the aesthetic patient journey, including pre and even post-procedure. So when we talk about post-treatment recovery, we want to help address the inflammation, help address the barrier recovery and whatnot. And GHKCU is an incredible peptide that can be utilized for this. So right now we're able to compound GHKCU as a product on its own. It is what's considered a carrier peptide. That means it's going to carry different nutrients and whatnot to the area that it is applied to. I will dive into GHKCU in a little bit more soon. I can't wait to tell you more about it. But some other post-treatment ingredients would be peptide blends and then barrier repair formulations. Keeping that barrier strong is so important. That's going to keep bad things out. That's going to keep hydration in. It's going to help with the structure of the skin as well. So, as patients continue on, there's ongoing topical regimens that can help to address skin quality, pigmentation, texture in these post-weight loss patients. Some key ingredients that I will focus on today are going to be that GHK copper, tretinoin, niacinamide, estriol, and caffeine. So post-treatment recovery, these are just like some things to keep in mind. This is what, what you suggest for your patient for the day after, for the week following, and then the weeks that continue. So again, GHK, I've said that quite a few times, but that's going to be great for post-procedural. So it really has some great wound healing properties. Also is just such an incredible peptide that's going to help with the skin's hydration. It'll help really just with the brightness and whatnot of a patient's skin. We do want to initiate barrier repair as quick as possible. In that 3 to 7 day phase, we continue with the GHK, introduce niacinamide for barrier restoration. And during this time, you'll want to avoid harsh actives. So things like tretinoin and other acids and whatnot. Just wait a little bit, let that patient's barrier be fully formed back and healing process take place before the tretinoin is used. And then weeks after that is the remodeling phase. So this is when we can reintroduce the tret, often starting at either reduced concentration or just an everyday, every 3 day regimen, building up to potentially every day from there. Continue the GHK to support collagen, and then they can resume whatever their full regimen was. Now we get to talk about the active ingredients, and this is the nerdy part of me that I love the most. So we'll get into GHK more. I did mention that we would do that. So my next slide actually is all about GHK. So I'm going to skip over that one. We'll talk a little bit about niacinamide. So niacinamide is the same as vitamin B3. It's really essential to help maintain the epidermal barrier. So it does this via ceramide synthesis. So ceramides make up about 50% of the skin's epidermis. It kind of acts as the glue that holds the skin cells together, excuse me. It maintains hydration and also protects from the external elements. Niacinamide is also known to help with inflammatory conditions, and it can be used for pigmentation. So we talked about how hormonal changes occur, and a lot of times with that, patients may notice darkening of the skin, melasma per se, and this can help to reverse or inhibit the production of that coloring. Tretinoin is great. So it's a keratinocyte, helps with keratinocyte site turnover, excuse me. So that's that skin cell turnover that sometimes as we age, that process decreases. Now, this is another very interesting mechanism of tretinoin. So there's an enzyme called matrix metalloproteinases. We're going to call them MMPs. Don't make me say that 5 times over. And what those enzymes do is they actually break down collagen. And when we are exposed to a lot of UV radiation and whatnot, which many of us are, that enzyme, MMP1, actually goes to work and really degrades collagen type 1. Collagen type 1 being the most active and abundant collagen in our skin. So tretinoin actually has the ability to turn off that enzyme. So not only does it help with skin cell turnover, etc., it can actually act on those enzymes to help decrease collagen degradation. Again, this is prevention. Prevention is key, but there are treatments that definitely can help. Caffeine. So caffeine is has interesting use on the skin. So a lot of times it's used in under eye treatments, kind of to help tighten that area. It has antioxidant benefits, and it also has vasoconstrictive benefits. So one thing we found in putting it in combination with some other products is that it can actually shrink the pores. So individuals will tell us that they notice a change in their pore size by utilizing caffeine. Estriol is fantastic as well. Our skin has, or our bodies have estrogen receptors throughout them, and that includes our skin. Our estrogens have estrogen receptor beta. Estrogen receptor beta is the most predominant in the skin, and it's going to help promote collagen synthesis, reduce inflammatory response, help accelerate wound healing, and it really actually has the ability to protect against UV-induced damage as well. Now, as we age, our estrogen levels decrease, especially in females, obviously, and therefore we need to replenish that estrogen. So the most common estrogen used in skincare is going to be estriol. It's E3 is what we call it. It's going to be more specific for that particular receptor, and it also does have some protective effects, which is fantastic. Patient or providers do get a little bit concerned at times that they're giving their patients estrogen. Will there be systemic absorption of the estrogen? It's given at such a low dose, and most oftentimes there isn't significant systemic absorption, excuse me. So just be made aware that it is used often. It is gaining more and more popularity as time goes on. I have listed some potential side effects. Most of it's going to be mild irritation. Do know with Tret, can cause dryness, peeling. That's why we oftentimes initiate it as an every other day treatment, every 3-day treatment before increasing to daily. Tret is always going to be best at night and then can cause sun sensitivity. So during the day, make sure your patient is wearing a sunscreen. All right. I told you we talked about GHK more. GHK is fantastic and it's beautiful. I don't know if you've ever seen a product that has GHK in it, but it has this beautiful kind of bluish purple appearance. And its benefits are endless. They really are. Here I've listed a few, but it has just so many benefits to it. So it's considered a copper tripeptide, glycine, histidine, and lysine, with that copper ion attached. GHK acts as I said it earlier, but as a carrier peptide. So it's going to help bring a lot of the nutrients to the area that it is applied to. So in this, it supports the collagen 1 and collagen 3 synthesis, the two types of collagens that are predominantly in the skin. It aids in elastin and glycosaminoglycans. So those are GAGs. In your skin's extracellular matrix, we have elastin, we have collagen, and then those GAGs. The GAGs help to kind of plump up and keep the collagen or excuse me, yes, the collagen and the elastin fibers nice and strong and steady. It'll promote wound healing, supports angiogenesis and tissue perfusion. So after those patients have had a procedure or whatnot, it can help, bring blood flow back to the areas to help with healing. We spoke about MMP earlier with tretinoin, but GHK actually has some benefits with the MMP as well. So that'll help to stop that collagen degradation and then also helps with inflammation. So this little guy has big bang for its buck. It's really just an incredible peptide. Two of the most common compounded formulations that we've created, are Stella and Cashmere. So both of these do have anti-aging benefits to them as well, or I should say healthy aging benefits. Stella is probably one of our most popular topical products. Stella includes the GHK copper with estriol, tret, and niacinamide. Now, if you do research, you'll see that GHK doesn't always play well with other active ingredients. In this case, we've done a ton of research and development on this product. We actually have chemists on our team, which is so fun. And they were able to figure out a way to have the GHK and the tretinoin come together where they will maintain their potency and they maintain their stability. So a ton of research and development has been done on that, to help ensure that what your patients are receiving is truly what we're saying your patients are receiving is truly what they're getting. And I will say that that is one of the greatest attributes of Strive, is that they really focus on the quality of the product. So that has to do with research and development. It's a huge cost to us, but it's so important that what your patients are getting are quality products. So Stella's great for anti-aging, has the estriol in it. Cashmere I actually created cashmere for the intention of patients who had lost a lot of weight, who had skin laxity, who were dealing with crepey skin, and found that it not only works for that, but it works very well on the face as well. So it's going to help with the skin cell turnover, help with the collagen maintenance, but then the caffeine again helps with pore size. So these, I think, are probably two of our most popular GHK topical products. They're prescribed often. And again, they're beautiful. They are placed into a particular base or cream that has shown to keep them stable. We've tried it in a number of different bases and creams. The cream this one is in is called Penderm, and it's a fantastic base that we've done all of the research and development on these products. Okay, so now that we've talked about the procedures that can be done, again, Dr. Kaplan's would do a much better job at that than I did. We've talked about some of the products that we can use. How do you build membership stickiness with this? So the thing is, these patients, once they come to you once, they'll come back again. So a lot of these procedures and whatnot are going to require more than one session. So that brings them back. That gives you an opportunity to speak to them, see how they're doing, see what else that you can maybe help provide to them that you can add on and whatnot as well. So there's compounding subscriptions. So a lot of these products would require ongoing prescriptions. So that is, something they can be on a monthly cadence to receive the prescriptions. Patients are going to notice visible and measurable progress. Document it. So show the patients the before and after. That's going to keep them coming back. That's going to keep their excitement. And then identity level investment. So patients who invest in aesthetics may become engaged in their healthcare plan more. Again, as I said earlier, they might start looking for different ways to better themselves. They might be looking for hair care. They might be looking now for longevity products. So all these things that you can continue to build them to help with their longevity, to help with their wellness. Revenue stacking. Now, I don't know the exact numbers, but there is financial benefit. So when you only offer a weight loss program, there's a limited amount that you will receive from the patient. When you add a weight loss program, plus maybe some aesthetic services, plus some topical dermatology services, there is the potential for that increase in membership, that increase in what you will receive as a provider. So, revenue stack, you have your weight loss membership. You have your GLP-1 medication management. That is, your diet and exercise education. You offer some skin tightening procedures. They have recovery plans that include the different products that we spoke about, and then increased topical products. So you can see that by just adding maybe just this one service, how vast the opportunities are for you as a provider and for your patients. So implementation, how are you going to do this? Let's screen our patients when they're about that 10 to 15% weight loss, because again, the statistics show that that's about the time that a patient starts thinking about this. You initiate a topical regimen. Maybe you just initiate GHK by itself. The patient will notice a difference in just GHK on its own. You begin to add the services, then you have the recovery plan, and ultimately they're transitioned to the maintenance tier where they're going to continue to come back to you requesting those products that they have noticed have changed their skin, and then that might go to other wellness opportunities as well. So in the end, I think skincare is incredible. I love seeing a patient's transformation and confidence. Once I've watched my sister-in-law go through it. She's lost about 200 pounds on a GLP-1, and her confidence just exploded. And her interest then in taking care of other areas of her body, other areas of her health changed. And I think skincare is just a great avenue to get those patients started. So I came up with this a while ago, and it's kind of been my mantra for what skincare does. Skincare is built for your moments, the ones where your reflection makes you pause, the days you feel radiant and the ones you don't. It's for every chapter of your skin story. not to change who you are, but to help you show up confidently, unapologetically as you, because you're more than your skin. And I think that's the thing we have to remind patients. Sometimes with aesthetic and skincare, it can seem, it's just cosmetic or it's very superficial. But really, when you can show up confidently in your skin, it really changes who you are. It changes how you approach life. It changes conversations you have. So, with that, I thank you for your time. I don't even know if I went over. Hopefully, we still have more time. These are some great references and some great ways to, if you want to continue learning. And then, of course, thank you. So I'll pass it back over to Katya and answer any questions that may have come in.
Thank you so much. This was so great. I will also say GHKCU is my favorite. It is the best. And the noticeable difference that you see, it's like really incredible. I've also tried tretinoin and, that does the flakiness of the skin. But once you get used to it,
Mhm.
it also definitely helps. But man, the GHK, it was a game changer.
Yeah, absolutely.
Yeah, I totally agree. Like, there's a lot to be said for yeah, feeling confident in how you present yourself to others. For people that are starting their weight loss journey, like, would you recommend that people kind of can start using these products like as they start using their GLP-1s, or is it more of a recommendation again to get them starting to lose the weight and then and then integrating it into their program?
Oh, I think integrating skincare as soon as possible is terribly important. Just over time, so quickly, collagen can degrade. So and that's when you start, noticing changes in skin, wrinkle depth, things like that. Even in young individuals, GHK has incredible benefit. So there's no reason to wait on any skincare, whatsoever. Obviously, you have to determine what your patient's needs are, if there's any allergies, other issues as far as that go. But I think having healthy, great skincare at any time in life is fantastic.
All right, so I will start looking through these questions. Are there customized topical formulations that have demonstrated benefit in improving skin hydration, flexibility, or fibrosis in sclerodermal patients, specifically face and neck?
Yeah, so we can customize really any formulation. The ones that I provided here are just some of our most common APIs, but we can customize formulations for sure. We are able to use niacinamide that's really going to help with hydration. We can utilize sodium hyaluronate. That's great for hydration as well. That really helps the glycosaminoglycans kind of puff back up. So we can really formulate a product however you want. Now, there are certain products that we do not compound with. So any API or active pharmaceutical ingredient has to have a USP monograph. That USP monograph is what allows us to compound with it. So if you come to us with certain APIs or certain ingredients, we just might not be able to compound it. We really do our best to find a way to get them in there so that we can provide your patient with the most benefit. But do know that you can customize a compound for a patient for sure. So
And then what is the depth for numbing?
yeah, so as far as the millimeters go, I don't know that off the top of my head. That is definitely something that I can get that information to Katya and get that back to you ASAP. I don't have that information up right now. But the product that's going to provide the most depth would be your lidocaine tetracaine. So, and then I think I saw a question about the percentages. That's the other fantastic thing about a compounding pharmacy is that if the product seems too strong for a patient, since these are patient-specific prescriptions, excuse me, we can alter it. So if it seems like it's too strong, it's too severe, let's alter it, or let's try putting it in a different base. So a different base might change how that patient will react to the product itself.
And about how long does it take for patients to start noticing changes with the GHK?
So for the GHK, really quick. Like it's so funny. I'll give GHK or a patient will receive GHK, our sales reps are the funniest about this. They state it's like an overnight change, but it is very quick. So with GHK, you're going to notice a change in just in how your skin feels nearly overnight. It's wild. Obviously, over time, it's going to have more and more benefit, but the product itself is just so fantastic. And again, the cream base that it's placed in really helps with the penetration of the product to the correct dermal areas and whatnot. So you'll notice a huge change with GHK very, very quickly.
Yeah. And I've heard you can also have the GHK, you can do microneedling for your for
Uh-huh.
hair growth and those types of things as well.
Yeah.
Yeah.
Yeah, I've seen that. I've actually seen like jelly masks made out of GHK that
Yeah.
they'll use on patients. So yeah.
Yeah. Are there any contraindications for GHK?
Not really. GHK is a natural peptide that, is in your system or whatnot. Obviously, some patients might have some sensitivity to it, but there's not a list of any severe contraindications.
Yeah. And can you put these products on other places besides your face? Arms,
Yeah.
thighs, abdomen,
Oh yeah,
whole
for
body.
sure. Everywhere. Rub it everywhere. Yeah, no, honestly, that's what cashmere was made for. Cashmere was made for those areas where patients were noticing crepey skin or whatnot. The GHK is going to, help with collagen buildup throughout the skin. Is intended to help with the skin cell turnover, also helping decrease that MMP1 enzyme from de degrading the collagen. And then caffeine will also help to kind of shrink that skin back up. So help with the crepiness of the skin, change the appearance of the skin itself. So yes, it can be used all over the body.
And I'm assuming the answer to this is yes, but all these products will work on women that are going through, peri, postmenopausal, hyperpigmentation, because you see all sorts of different types of changes with your skin and
You
that's
really do. And we actually have products. So the estriol products, if a patient isn't deficient in estriol or estrogen, so your younger 20-year-olds and whatnot, it's not going to have as much benefit as those in perimenopause or menopause. So the option would be to potentially take the estriol out. So again, a custom formulation. But there are different products that we offer. So funny thing about Stella, I'll tell you a quick little story. Stella was a product that I had come up with, and I needed a name for it for this nighttime regimen. I had a daytime regimen as well, and we still have that. My daughter's names are Aurora and Stella, and Aurora means day or light or whatnot, and then Stella means stars or night. So that's how they got their names. It's after my daughters. I've tried to change them a million times, and people won't let me change them. So if you've heard this story before, I'm sorry,
I
but
love
that's
it.
where the names came from. So we have products that are intended for daytime. We have products that are intended for nighttime. And then we can adjust them to be exactly what your patient needs. Um, now, there's also a lot of brightening products, brightening agents, with a lot of different options. So do keep that in mind as well. So I think I saw somebody ask if we can add phenylephrine to lidocaine tetracaine, and yeah, we can. Yeah,
Okay.
I just listed some of our most common products. So yeah.
And then there's some questions on dosing. So typical dosing for GHK, dosing for cashmere as a body treatment.
Uh-huh. Yeah, so the most common or the dose of GHK that we've found maintains its potency and maintains its stability in the cream is 3%. So you'll see that our products will most oftentimes contain that 3%. GHK is very finicky again. And so having it at the 3%, that's where the potencies seem to stay the most stable. So 3% is a great option. Kind of going above that isn't going to provide, too much benefit. Going lower than that is fine. It just may not maintain its potency over time in certain bases.
And what about dosing with tretinoin?
Dosing with tret. So in these formulations, it's fairly low. Our formulations have 0.01%. And that's going to help, with the skin cell turnover and also have some prevention. Now, we can increase that dose, but tretinoin for a lot of patients can be pretty harsh. So we just have to be very mindful about getting too high with the tretinoin.
And are there different results between GHK Troche versus cream?
Versus cream, yeah, they work completely differently. The troche is going to work from the inside out, whereas the cream is going to be more topical. Now you can use both. The troche really does have a lot of other benefits as well, a lot of other wellness, vitality benefits. So it's a great product to have. But utilizing the cream as well will help to just focus on that particular area, whether it's the face, whether it's somewhere on the body. Utilizing in them in conjunction is fantastic, though.
And then if it's treating a patient with
Mhm.
hyperpigmentation, can the estriol and Stella make it worse?
That's a really great question because a lot of times it is that change in hormones that will cause the hyperpigmentation. Now, the estriol is going to be considered a weaker estrogen and binding to the more protective receptor. So there is some potential. There actually is some potential for that. I would say I haven't had a patient complain of that. Now, could it have, if you have a patient who is very sensitive, there is the potential, unfortunately. And in that case, the estriol can be removed. Or you can switch to, the cashmere or something like that that has a different a different anti-aging ingredient. But we make different formulations that'll have the hydroquinone and kojic acid and a number of different products that are going to help with hyperpigmentation as well, really help to brighten the skin.
Yeah, I've tried the kojic acid and for hyperpigmentation versus there was something I was on that was prescription, and the kojic acid works incredible for hyperpigmentation.
Yeah, and we have
Yeah.
products that have tranexamic acid in it. So
Yeah.
that's going to be something that's great for those patients who don't either want to use the acid or the hydroquinone. And one thing that's very cool about, now I'm going on tangents here, one thing that's really cool about a lot of our acne products is that they have tranexamic acid for brightening. So for those patients that are dealing not only with acne, but some of the residual acne scarring or changes in pigmentation, those products will help to lift that and change that and brighten the skin while also helping with the acne.
And then, so you had touched on the daytime versus nighttime routines, but specifically for night body, is there anything you would recommend that you specifically use in the evening?
The cashmere cream would be fantastic. That would be a really great cream to use on the body at night. It does have the tretinoin on it, so a patient would want to, wash their body in the morning. That way, there's less sun sensitivity. I would say that's probably, a wonderful product. Otherwise, a product with ceramides in it. Ceramides are, really going to help to build up that skin barrier, and really help to protect the skin.
Yeah. And then for GHK, you mentioned, you put it topically on the area that you want to see the results. But for general skincare, if you're going to do the injections, where do you recommend doing the injections?
We don't have the GHK injections just yet, so that's not really an area I've dove too far in. The GHK injection are going to be very similar for anti-aging properties, similar to the troche. So most oftentimes it's used as a subcutaneous injection, so it's not going to be necessarily just for skincare. It really is going to offer all over wellness and vitality.
And then what do you recommend for a lasting history of psoriasis facial?
Oh, that's tough. Oops, my screen. Am I still sharing my screen?
You are.
Oh, geez.
It's
Okay.
okay
I
though.
pressed the wrong button. Let me unshare. I don't know how to do this. Sorry. Oops.
You're
Oh, wait.
good. You're good.
Okay. There we go. Did I stop?
Perfect. Yes.
Okay, perfect. Sorry. Sorry. I pressed a
No,
button
you're
and
great. You're
all of a
great.
sudden I'm all over the place here. Okay, I missed the question. What was that?
So this one, if somebody has a history of psoriasis on their face, if there's specific products you recommend.
Oh boy. Okay, wait, let me think. Uh, so, I think you're going to want to make sure to stick with some just, you know, some very sensitive products or products for sensitive skin, excuse me. Things like niacinamide would probably be really great. You could do some lower potency like corticosteroids. So we have some products that have low doses of hydrocortisone in them. That might help. I don't have a perfect great answer for that right now, but that again, I'm happy to get Katya some more information on some products
Okay.
that we could recommend on that. Yeah.
That'd be great. Yeah, there's also if you have recommendations on a product that helps sebaceous hyperplasia.
Okay. Yeah, let me get I'll get you information on that as well. Let me write these down
Okay.
because I'd rather be able to provide you with exact great information. So, okay.
Perfect. Yeah, and then there's quite like a cheat sheet on dosing for all the creams and things you guys have available.
Yeah, for sure. And then I see a question here. Any products for melasma? Melasma is going to be our brightening products. So Luminance and Brilliance are two of our most incredible brightening products. Luminance containing hydroquinone and kojic acid, kind of for more of the severe. And then the Brilliance has the tranexamic. So that would be more of your maintenance. So yeah.
Perfect. Well, this was so great. I could, stand here and chat with you about this all day.
It's my
I
favorite
think I think
topic.
all I think all these products are so great. And yeah, we'll make sure questions, additional information. We'll make sure that we share them out with everybody after.
Yes, absolutely.
Well, thank you so much for joining us today.